Uganda has made progress in malaria control, registering 15 deaths per day from 320 people per day 10 years ago, figures from Malaria Control Program Ministry of Health, particularly among pregnant mothers, newborns and young people. However, Robina Kaitilitimba, Executive Director, Uganda National Health Consumers Organization, believes with adequate access to treatment, those numbers could be much lower.
So people who are not reached, if you look at access to services, the distances, although government has reduced to a certain extent, there are still large communities that are not able to access services.
Kaitilitimba says other indicators like nutrition, education, water and sanitation deserve attention.
A comprehensive approach to addressing not just malaria, but primary health care. I think we did a backslide on primary health care and universal health coverage, and government needs to go back.
She calls upon the local government to use the available budget allocations to intervene.
Comprehensive approach that is looking at community empowerment, community rights, and access to services. If we don't do that, we are going to have even health insurance, and the money that we put into health insurance will just do malaria, and the other diseases will remain a challenge.
Dr. Jimmy Opigo, the program manager, Malaria Control in the Ministry of Health, says environmental factors provide breeding zones for mosquitoes. He advises behavior change among public.
This needs very heavy involvement of all sectors and a very strong government commitment. It needs also to be something highly prioritized, the way COVID has been prioritized. So we are still struggling to get malaria prioritized to that level for people to perceive the risk.
Uganda will join the world to mark Malaria Day, observed annually on 25th of April. Opigo says this year's celebration will embrace the theme domesticating the malaria fight with many activities.
One of the main activities we have with Kira municipality and Rotarians is a bicycle ride to mobilize people. But alongside this, with Plascon, we shall paint a few homes, we shall spray a few homes, we shall do cleaning.
Ken Mugisha, chair of the board Malaria Free Uganda, is confident Uganda will be malaria free in the next 8 years.
We are launching what we call Zimbli, and this is one of the achievements for Malaria Free Uganda, because we are bringing the corporate world on board to start giving back a CSR, or corporate social responsibility, in fighting diseases, in making sure that we support communities in areas of focus where we feel they have challenges. We come in to support. And now this is more specifically malaria.
Shamim Natebwa, CTV PM Edition.